Hello, good afternoon, and welcome to the first of our New Year's series of EURORDIS How to Digital series of webinars, the third in our series so far. I'm really delighted today to be able to share with you a webinar on the topic of Rare Disease Day and the use of digital tools in Rare Disease Day, which has become such an important event for our community. And within that Awareness Day, I think we've seen the growth of the use of digital and the power of digital to really raise awareness for the cause of rare diseases in society over the past 10 years or so. You may remember that Rare Disease Day began in 2008 with the involvement of 18 countries, mainly from Europe. But last year, we embraced participation and involvement from more than 90 countries right around the world, and with a very vibrant and interactive campaign, particularly on social media. So today I'm delighted to be joined by one of my colleagues, Lucy Michaeludis, our communications junior manager, who's really the driving force and responsible for many of the operations around the Rare Disease Day campaign this year. And over the course of the next 30 minutes or so, Lucy's going to share with you all the many different ways and tools that are out there now to help you get involved in the most active way possible in this year's campaign. Please feel free to share any comments, remarks, or feedback in the comment box right below this video. The slides for today's webinar will be made available to you. I'll be sharing that link, and the recording will be available also in the next couple of days for any of you who wish to watch it on demand. Lucy, thank you so much for taking some time out today to share with
Thank you.
your skills today, and it's over to you. Thank you.
Thank you very much, Dennis. I'll just begin sharing my presentation. Thank you very much, Dennis. I'm very pleased to share with you today a webinar on how to use digital tools for Rare Disease Day 2019. So before we begin, I'll just give a brief overview on the content that we're going to cover today. I'd like to begin with a brief introduction to Rare Disease Day for those of you who are unfamiliar with the campaign so far. And then we'll move on to talk about using social media for the campaign, using video content, and then we'll finish with looking at some digital tools that you might like to use during your Rare Disease Day events. And as Dennis mentioned, we'll have time for some questions and interaction at the end. So Rare Disease Day, as Dennis previously mentioned, was created by EURORDIS and its Council of National Alliances back in 2008. Rare Disease Day 2019 will take place on the 28th of February, and it takes place every year on the last day of February. As an international awareness-raising campaign for rare diseases, it's an overall a patient-led campaign that aims to raise awareness through events, through fundraising, and through advocacy actions. And we aim to raise awareness amongst different stakeholder groups, including policymakers, health professionals, industry representatives, patients, and the general public at large. So now we can begin to talk about using social media to promote certain elements of the campaign. Now, many of you might already be familiar and already be using some of these platforms, but I'd just like to give a brief overview of how you might consider using them for the Rare Disease Day campaign. So Facebook is brilliant for sharing photo and video content, as well as slightly longer posts, kind of like a style of Humans of New York style posts, where you can share written testimonies via Facebook. Facebook also has the ability to create events, so you can create an event for your Rare Disease Day event. And you can also use Facebook Live, as we are doing today. Twitter, on the other hand, favors shorter posts. It's also a great platform to use in interacting with influencers in the rare disease community by retweeting their tweets and using hashtags involved in a campaign to get that hashtag trending. LinkedIn is a great platform to use if you want to reach out to companies in particular. Instagram favors video and mostly photo content. And Snapchat as well is photo and video content that only is visible to the public for 24 hours. So maybe it might be something to use on the day of your event or on Rare Disease Day itself, as it has a very short lifespan. Hootsuite is a great tool for those of you who are managing multiple social media channels. It allows you to prepare and schedule posts in advance. TweetDeck is integrated within Twitter and offers a dashboard where you can really analyze the kind of interaction you've had with your social media content. So you can see all your notifications, how your posts have been retweeted and commented, and you can also follow the interactions and use of particular hashtags. So now I would like to present to you the Show Your Where campaign for Rare Disease Day 2019. The Show Your Where campaign was started in 2018, and following its great success last year, we've decided to continue it for this year. The campaign itself was set up with the idea to maximize our impact across social media and to engage in a different way with our online communities. So the Show Your Where campaign works by having a call to action. We call on our supporters around the world to paint their face using brightly coloured face paints, and usually in the colours of the Rare Disease Day logo. We ask them to take a photo and to share that photo on social media using the hashtags Show Your Rare and Rare Disease Day. So, using the Show Your Where campaign as a primary example, we'll look at how to use social media in different ways. And the first way is how to build a visual identity. Within the visual identity of the Show Your Where campaign, which takes its colours from the Rare Disease Day logo and is very much part of the Rare Disease Day branding, on the Rare Disease Day website, we have made available different campaign materials that you may like to download and use in your communications and promotion of the Show Your Where campaign. So available to download are different versions of the Rare Disease Day logo. The fonts that are used across the campaign, so the fonts that are featured in the Rare Disease Day 2019 poster. The visual materials, including cover photos, as well as the Twitter and Facebook frame. So you can take part in building this rich visual identity for across the campaign by downloading and using these materials on your websites, on your social media pages, and that kind of thing. We also use social media across the Rare Disease Day 2019 campaign to share key messages. So these might be messages associated with the campaign that we're trying to share via the video and the poster as part of being part of a supportive Rare Disease Day community, or there might be specific call to actions. On our website, we try to reach out our different stakeholder groups in the different ways they can get involved. So we often use social media to reach out to patient organizations to invite them to submit an event to the website. We reach out to other stakeholders so they can become a friend of Rare Disease Day. And patients around the world can submit their own personal testimony about living with a rare disease via the Tell Your Story section. As well as with the campaign materials we develop, we often use social media as a primary way of promoting downloads of the poster and of sharing the video to make sure it has the greatest impact possible. And you might like to use social media to promote key calls to action that help you in your Rare Disease Day activities. So this might be to register for your Rare Disease Day event, to donate to the fundraiser you're organising for Rare Disease Day, or to volunteer for your event. We also use social media to build engagement with the campaign. The Show Your Where campaign was developed specifically to have this interactive two-way communication with the rare disease community at large. So you can help promote this engagement by sharing the Show You're Aware social media campaign and encouraging people in your network to share photos and to use the hashtags Rare Disease Day and Show You're Aware. As well as sharing the Show You're Aware campaign within your own networks, we are also this year trying to take the engagement to the next level by involving celebrities and high-profile people within the rare disease community. So if you have previously worked with a celebrity or someone high-profile on this kind of campaigns, we really encourage you to reach out to them and ask them to share a message of support for the Rare Disease Day 2019 campaign. There are many ways they can take part. They can paint their face and share a photo, or they might like to download the hashtag board here, which is visible on the slide. And we really encourage them to use the hashtags Rare Disease Day and Show You're Aware. For example, in 2018, David Cameron shared a message of support and included the Show You're Aware hashtag and tagged the official Rare Disease Day Twitter handle. And this means that we can share the messages of the campaign and have a higher impact across a brand new audience. Now moving on to talking about the Rare Disease Day 2019 video campaign. Every year we've been producing video content to share a key message for the campaign. And this year is a unique year as we have 4 videos that we'll be sharing. To launch the Show You're Aware campaign, which runs during the month of February, we'll be re-releasing the Show You're Aware clip that was first launched in 2018. And then in addition to the Show You're Aware clip, we have produced 3 new patient testimonial videos with our partners in Europe. So we'll be releasing these testimonial videos in the run-up to Rare Disease Day itself. So the videos to keep an eye out for and to help us in resharing is from Carlo in Croatia, who's living with neurofibromatosis type 1. We then have Philip, who also features with his mother Alina on the Rare Disease Day 2019 poster, and he's from Romania and lives with achondroplasia. And lastly, we'll be sharing a video from Spain, which features Lorena, who lives with Phelan-McDermid syndrome. So this is an overview of the video content that we'll be disseminating as part of the Rare Disease Day 2019 campaign this year. So using videos in your own campaigns, they can be a brilliant way to have a simple call to action. And this is what we are using the clip to promote the Show You're Aware campaign. The clip is a very good way that it presents the campaign and how to take part. And so we'll be releasing that soon to launch the beginning of the Show You're Aware campaign for the beginning of February this year. This year we've produced the patient testimonial campaigns to really bring an element of storytelling to the messages we're sharing as part of the campaign this year. And lastly, raising awareness can be done through videos, as we've mentioned before about reaching out to celebrities or high-profile people within the rare disease network. It can be a great way for them to, if you are in contact with them, to have a video recorded and something that can be shared on the day to raise awareness. Another use of video that you might consider using, and it's something we've seen from other patient organizations, is to record clips of your Rare Disease Day activities. So it might be in the preparation, during the event, and some behind the scenes, and then to edit that into a kind of Rare Disease Day recap video, which could be released after the day itself. Video dissemination. The Rare Disease Day 2019 video campaign will be disseminated primarily via the rarediseaseday.org website, and also within the Rare Disease Day YouTube channel. And this year we're creating specific playlists to group the 4 videos by language as well. Another key tool disseminating videos to have a wide reach and to potentially have a viral effect with our videos is by social media. And this is where we'll be encouraging you all within your networks to watch and share. Another way that you might like to disseminate the videos, and it's something that's happened in the past with our national alliances who have reached out to local press in their area and to television channels, and we've had the Rare Disease Day videos played or short clips played on national television. Another way, which you might not have considered, is to use videos as part of an event. So they can work very well to open an event or at the close of an event. Finally, I would like to talk about using some digital tools to enhance your events and make them more accessible using digital tools. So the first is via Livestream. So this works best for conferences or panel discussions, and this can be done relatively simply with an iPad or a smartphone used on a tripod with a Wi internet connection. And this live stream can be embedded onto a web page, or it can be used via Facebook Live or Periscope, as we're doing today using Facebook Live. And these are a great way of reaching audiences that haven't been able to travel to your event. Another way you can use video in a slightly more, in a less formal way, rather than live streaming the entire event, you might like to use Instagram or Facebook stories. So this is a way of sharing a photo or a short clip for a video via your Instagram profile or Facebook page. And this will be available within your story, so it'll be available only for 24 hours. So that's why it's quite good to use on the day of an event. And it can be used to show the behind the scenes elements and that kind of thing, to bring a different perspective to a more formal live streaming element. And lastly, for events, what we is a good way of being able to interact in real time with the people both at your events and those following online is to use live tweeting. Now, live tweeting is very fast-paced, and as the event moves quickly, it's very wise to prepare in advance. So for live tweeting, it's important to establish a hashtag that's associated with the event, and that not only helps you to see how other people are using the hashtag and responding and making comments during the event, but it also helps other people to find and to follow that hashtag and to see exactly what's being said. So as I mentioned before, preparation is key for live tweeting. So you may want to think about tweets that can be prepared well in advance based on the content and the speakers that will be present. And you would also like to think about the organizations or the speakers or people present that you would like to tag and ask to reshare or retweet. And these are the kinds of things that can be prepared in advance. Live tweeting is also a great way of sharing photos and quotes as speakers take to the podium. That can be a nice way to share what is being said at your events. And I do believe that is it from me in terms of going through the different digital tools, which is good. So now we have lots of time if you'd like to go into more detail about the Show Your Wear campaign and how to get involved. I'll just stop my share.
Great. Thank you so much, Lucy. There was
Thanks.
so many ideas there, I think, that came across from what can be done in this year's campaign. We've had people from all over the world, people from Nepal, lots of people from Sweden, from the UK. So thanks very much for joining us today. I'll get around to your questions now. So there was a question from Jana from Sweden asking, would there be a new video for this year's campaign, which I think we've answered. But I have a question about the translation process or the subtitling process. If you want to get your video in your language, I mean, how many languages are available? Because I know in the past we've done, you know, we've translated into a lot of languages. So that's my first question. And if you're from a country, for example, I don't know, like Nepal, for example, and you want to get the video translated, is there a process for that?
Yes, indeed. So as we know, the Rare Disease Day campaign has really grown since 2008, and last year we had the Show Your Rare video was available in over 30 languages, and we're aiming for that. And this year, and we have planned to translate the 3 testimonial videos as well into as many languages as possible. In terms of getting translation of your video, we do have kind of established partnerships with rare disease patient organizations based around the world. So we reach out to them every year, and they very graciously volunteer to translate the subtitles for the videos. So via the video page, rarediseaseday.org/videos, we will be making all the different translations available. And if you see one, and if you see that your language isn't available, then we really encourage you to get in touch. And if you're willing to translate it yourself, that would be even better, and we can work directly with you to send you the files that you'd need to translate and send it back to us.
Okay, great. That's very clear. So we have a couple of questions about the Show Your Rare campaign. So I'll start with them in order. So Eva asked, for example, if you don't want to paint your face, which you know could be the case, can you still get involved in the Show Your Rare campaign, and how?
Yes, indeed. I believe in some of the photos we saw people holding up a hashtag board. And that's also available to download from the Rare Disease Day website at rarediseaseday.org/downloads. So there's a printable hashtag board that you can hold up if you choose not to paint your face. You can also, I mentioned the Twitter and Facebook frames, so using those on your profile picture and sharing that with the hashtag would also be a way of using that on a photo that you already have, that already exists. And there are other ways, if you want to do some painting on paper and holding that up as well. It's all about kind of standing in solidarity and sharing that message.
Right. So I think that also answers Carmen's question, actually, who was asking if it's up to each person if they want to paint their face. The answer to that, I presume, is yes, and you can use...
Yes, of course. We, within the Show Your Rare video clip, there are some nice examples of face paint designs you might like to use, and we also on the website have a dedicated web page and a little downloadable info sheet that again has some visual examples that you might like to copy. But again, it's really up to individual people, and we are hoping to reach out to policymakers and other celebrities, and sometimes face painting just isn't something that they would consider doing, but there are other ways to reach out. But the face painting has been a success, and it's very fun, and it can be incorporated into all kinds of grassroots events. So there are many different ways to get involved.
Great. Around the hashtag, so Timo from Sweden has asked, what's the main hashtag for Rare Disease Day? And then perhaps we can just talk about hashtags after that. If you just
Indeed. So the hashtag Rare Disease Day is the main one, and probably the one that's probably resonates the most internationally, let's say. And then with the Show Your Rare campaign, the hashtag Show Your Rare is really about kind of standing in solidarity and kind of encouraging other people to show their rare as well. So when sharing your Show Your Rare face paint selfie, or using the Twitter or Facebook frame, it's really great to use that hashtag. As we saw in the tweet from David Cameron, he used the show your where hashtag, even though he didn't necessarily paint his face, but he's showing that, you know, he was supporting that part of the campaign and was encouraging others to do so.
Yeah, I mean, just on the topic of hashtags, obviously there is the main hashtag for the overall campaign, but you know, you did mention, you know, live tweeting, and I'm thinking particularly for political advocacy and policy-driven events on a national level. You know, would you have any advice there, or what perspectives have you had from past campaigns about the use of hashtags, you know, for events?
Sure. I would say if you plan to live tweet an event, or if it's for a specific to share specific policy or advocacy messages, it's really great to have a specific hashtag for that. And if it's an event that takes place every year, you might like to make it specific to this year and include the year. For example, at EURORDIS we have a symposium which doesn't take place every year, but we're now in 2019 we'll be hosting the third symposium. So our hashtag there is Rare EU 2019. So you might want to, if it's particularly about trying to reach out to those policymakers in the rare disease community, then you might want to include rare. If it's at an EU level policy, maybe you want to include EU or the city that is taking place in, or the country. So yeah, it's up to you to decide like how you'd like to make a specific hashtag and to make sure it hasn't already been used, of course.
Right. Yeah. Yeah. And we got a couple of questions. Well, we got a question from Sarah from an association Tuberous Sclerosis in UK about measurement and you know, how you can measure the impact of your campaign and what tools might be out there. I mean, I know that there are many tools to monitor hashtag usage and reach and uptake. Yep. Any other specific tools that you'd like to mention?
I think on the day itself, we spend and the day before and afterwards we spend a fair bit of time trying to see if Rare Disease Day or Show Your Rare was trending around the world and kind of who's been using it. I think TweetDeck is really very comprehensive for Twitter. With Facebook, I haven't found an external tool that allows you to monitor that in the kind of dashboard setting. So within Facebook, I'm always kind of searching the hashtag and looking at posts and photos, and there are different ways. So that's kind of more of a manual way of searching. I believe last year that we used, there are different tools available, some you have to pay for and some are free. I think we used Trendogate last year, which was a free tool which allows you to type in a hashtag and to select the period of where you'd like to kind of judge the activity around that hashtag, and it tells you when it was trending, in which country, and so that could be a useful tool. One key thing to remember is not to leave it too late to try and use these free tools, because it's better to do it on the day or the day after. Otherwise, if it's a week after the event, it's difficult to kind of go back and find that data.
Right. Thanks for that. In terms of the timing of, when you, either as an individual or as an association or as an alliance, can do any or all of the, activities that you mentioned, what advice would you give in terms of timing, in terms of, when you should start, when you should maybe build upon what you've done, and that kind of question?
Yes, I think so. For us, the Show Your Rare campaign really begins at the beginning of February. So we have a kind of peak in our activity in promoting participation in that campaign. Of course, it depends if you're holding a particular event on the day itself. or if it's a bit before or kind of after Rare Disease Day, is to really capitalize on Rare Disease Day itself as a way to either look back on the event or to kind of project forward to the events that you're holding. I think we're doing more and more kind of behind the scenes and preparation type posts to kind of encourage people to register for events or to join a live stream. So I guess it's important to think about again how you want people to join. How long is your registration period open for, and if you're having a live stream, when to communicate about that. It's important to do that in advance so people know where to join.
Okay. We have a question from Michelle from the Children's Hyperinsulinism charity in the UK. So they're having a group trip for families coming up a few days before Rare Disease Day. And Michelle asks, what advice would you give them to help promote Rare Disease Day during that particular event? A good question.
Okay, so it's a kind of a trip, did you say? A trip to, so I just want to
a group trip for families.
Great. So maybe what works quite well is these group photos. So we get a lot of photos submitted through the website and on social media. So when you're having a kind of gathering or a trip, so you might like to build in time, and you might like to think about preparing some face paints if that's appropriate, or printing off some of the hashtag boards or the posters, and setting up a group photo that you can then share on the day of the event, or on Rare Disease Day itself. You might like to build that in. We also have a version of the logo which can be coloured in, so that could be something fun for children to do. And I'll be happy to send that over. We also have a Rare Disease Day shop that launched this year. So maybe it might be an idea to have some Rare Disease Day branded bags or things like that, if that's useful for bringing things on the trip with you as well.
Okay, there's lots of good ideas there for that kind of event. You mentioned earlier on in your presentation, about the different channels. So, there was LinkedIn, Facebook,
yes.
Twitter, and so on. I mean, we every day.
Yes, there are many. They're always growing.
Right. Would you like to just give me a short overview, in your experience, on the differences between the channels in terms of maybe the different kinds of audiences, and how you might want to tailor your content to each of the channels? Just a kind of an overview from your experience.
Yes, indeed. Yes, it can be difficult when there are so many different channels to choose from, and you're organising your activities for the Rare Disease Day campaign to decide which audience that you're trying to target. So I would say if you're working directly with people living with a rare disease and families or other patient groups, I would say Facebook is really the way to go. I think from our experience with the Rare Disease Day Facebook page, we find that we're interacting with usually parents of children living with a rare disease. For Twitter, we found that we're able to reach different stakeholder groups. So it might be healthcare professionals or clinicians involved in European reference networks. It might be key policymakers that we're trying to reach out to, and many other national alliances or patient groups will also have Twitter, so it kind of depends who you're trying to reach out to. As I said, LinkedIn is the social network in a professional kind of capacity, which favors interaction with companies. So if you're partnering with different kinds of groups and companies for your event, you might like to promote it via LinkedIn and to tag them. You might be able to find them more easily than on Facebook, for example.
Okay, and any comments on Instagram, given that our campaign is getting more and more visual?
Yes, given that it's getting more and more visual, Instagram is something that we've used to promote the more visual elements of the campaign, so the poster and also some nice show your wear visuals that we have as part of the campaign. So we share those via Instagram, and it's also something you might like to use if you have photos of your events. That would be a good network to use. We've also in the past used it to promote the EURORDIS Black Pearl Photo Award, which happened as part of the EURORDIS Awards, which is an event to mark the occasion of Rare Disease Day. So if you have a visual element or a photo contest that's part of your activities, that's a great way of interacting. And the hashtags as well work very well via Instagram, because you can follow a particular hashtag as well, so it's quite easy to be able to keep track of how your hashtags are being used, and you can encourage your followers to follow a particular hashtag if you're sharing photos from a particular event as well.
Yeah, that's great advice. I mean, personally, as I've seen the event grow over, or, Rare Disease Day grow over the past 10 years or so, the whole visual aspect of it in terms of, putting a face on your disease has made such a tremendous difference in the awareness campaign overall. And you rightly mentioned the poster, and you've said it earlier, and we'll say it again, and we've shared the link in the comments there of, the details of how you can download the poster from the
We do have very many different versions of the poster. So we've been primarily thinking about the digital tools today. So we have the web JPEG versions of the poster, which you might like to integrate into your web page or share as an image on social media. But of course, at your events, you may like to use the PDF print version as well, and that we have available. So on the downloads page, there are 3 clear sections for web, for print, and for designers. And in the for designers tab, don't be put off. Anyone can use them, and it's basically where we keep the PSD files of the poster, which allow for a translation of the slogan to be added. And so we find these prove very popular around the world, with the national alliances kind of taking the lead on using the official translations and making these versions available to download.
Okay, I mean, when I think about, the amount of times that Rare Disease Day has trended, for example, on a national level, or when we've seen the video being taken up on television on a national level, or as you say, the poster being translated, all of this makes for, a kind of a united campaign, but, making a big impact on the ground.
Exactly. We so with the campaign itself, by adding a translation, you're making it so much more accessible to your local community. But within the poster itself, in keeping that same visual identity, we're able to keep the strong visual element. And for example, in this year's poster of Alina and her son Philip, that that image of being part of a strong community that is still kept, but we allow for translations to be added, for it to be really adapted so that it works well on a local level.
Okay, an interesting question from Wesley. So, is it possible to hold an awareness campaign in the virtual world of Second Life?
I have to say that I am personally not familiar with the virtual world of Second Life, but if it's kind of a platform for having a fundraising or awareness raising campaign, then I think that may be possible. You might like to have visuals that could be uploaded, but without more detail on what exactly that would involve.
Yeah, it's a good question, and I mean, I would encourage Wesley to, if you're a fan of Second Life and you're adept,
it can be adapted to a different platform if that's a new. platform.
and use the tools that are available. I've used Second Life, and I have seen events being held on Second Life.
Oh, great! I'm really unfamiliar with it. So
yeah, the BBC have done a lot of live concerts and things like that, streamed into Second Life, and it has become a kind of a mainstream platform for some events, and for many people with some rare diseases. Actually, they're quite present on Second Life. It's a kind of a way to exchange and interact with others. So Wesley, please, you're more than welcome to go ahead and share it with us afterwards if you have any kind of meaningful impact. So I think, well, that's more or less the end of the questions for now. Maybe one last question I'd like to put to you, Lucy, before we go is, I mean, what are you most excited about this year's campaign?
For me personally, I am most excited about sharing the 3 new patient testimonial videos. I was part of the team that was able to travel and meet the patients and their families and the film crew in person, and I was present during the filming of those videos, which was a first for me, and I was really able to have a great experience with our national alliances that we were working with in each country. It was great to really see how excited they were and how they were using the Rare Disease Day campaign on a national level. And so I'm very excited to be sharing these new patient testimonial videos as part of the campaign this year. I did have a final comment about hashtags. So we were talking about using the hashtag Rare Disease Day and hashtag Show Your Rare. A lot of rare disease names exist as a hashtag. So maybe if you're supporting the Rare Disease Day campaign from within a specific rare disease group, or you want to reach out and kind of find other people with your disease, I would definitely recommend including that you're showing your rare for such and such disease, because that way that would be another hashtag to add as well.
Great. Okay. Well, thanks, Lucy, for sharing all these ideas with us today. Thank you, everybody, for joining from the different parts of the world from where you've joined, and for being so lively in asking so many questions and sharing with us your feedback. The recording of today's Facebook Live webinar will be available in the coming days on the EURORDIS TV section of the EURORDIS.org website. And the slides from today's presentation are also available for download. We've shared that link within the comments of today's webinar. And obviously, just lastly, to remind you all again of the Rare Disease Day website at rarediseaseday.org. I look forward to joining you again at the end of February for another How to Digital EURORDIS webinar. So we leave you today. Wish you all a great afternoon, great day, and thanks again.
Thank you very much.